Lumbar spine side flexion we can do in two different positions. One would be supine, and this is actually a really nice, well-controlled technique. And the other would be seated, quite a difficult technique to perform, and you tend to cause quite a lot of thoracic spine side flexion whilst trying to do it. So it's not a very specific lumbar only mobilisation. But there's what we have, so we've got bottom up and top down in terms of the difference between the two. So if they're supine, it's bottom up, and we're going to control from, again, the legs and the pelvis. And in doing that, it means it's going to be a lot of work for you, because you've got to take a lot of the weight of their legs and their pelvis. Bear that in mind, please, especially when you're planning out your treatments and the number of sets and reps you're going to do. It's going to be quite low, and you are the limiting factor, it tends to be, as opposed to the patient and their pain being the limiting factor. As with all of these, treat their back with a lot of respect in terms of taking things nice and slowly, not trying to be too jerky or moving double legs at the same time. Move one at a time. It makes things a lot nicer for them. They feel that you're not rushing them through motions. Stops them spasming up, and ultimately if they get a muscle contraction to try and limit you because it hurts, the chances are that spasm is going to stay there for a little while, which is then only going to limit and restrict your treatments. So performing a side flexion in this position, I'm going to raise the bed up a little bit more for me. So want the bed nice and high for you. And then we're going to take underneath the leg and supporting from underneath the knee at the distal end. And then this hand is going to come onto the side of the pelvis, feeling around iliac crest. So this is the iliac crest just in here. I'm going to support from there. And then I'm going to raise the legs up so they're around 90 degrees. What I then have to do is lift, give a certain amount of lift. You're not going to take the full weight of them because it's really, really difficult to do that. Extremely tiring, and you do need to look after yourself. You can make things slightly easier by having them a reasonable way over towards you on the plinth, but not too far, because you're going to move in this direction. And then so you have a slight lift, and then you twist round. So you need to be ready with your body to go in that direction. So here and here, raising up, so I've flexed. Now I lift, and then I twist. So you can see I'm twisting away from you towards me. Okay. Obviously we can grade it, so we could do just a real gentle grade 1. But for a grade 1, I'll tell you now, it's really hard. Grade 2, larger. Grade 3, coming into resistance, much more pressure, applying on. And then grade 4, towards the end of range. You'll probably find you'll like this one, especially for grade 1 and 2. Sometimes for a grade 3, it's quite difficult to get the real end of range forces that you would require for a grade 4. Moving on to seated, if you like to, what I want to do is if you sit up off the edge of the bed just for now, so we need to move this bed along. Your seat on the end of there, just coming down a bit, facing that way. Okay, for side flexion, actually, yeah, come around this way so we can see the camera with your back. So for side flexion, we're going to be working here from the top down this time. Last technique was from the bottom up, now we're going from the top down. Ideally, if the patient can have their feet on something as well, so they've got some level of support, depends upon the height that you need the bed to, and then the height of the bed and the room for the feet. So if you've got small stools, steps, those sorts of things, can be really helpful. If, for instance, for me, so I'm going to be wanting to come down, that's quite a long way for me to come down, so I'll probably raise this up, and then I can pop a chair underneath the feet so that they're nice and stable as a patient. Okay, so then I can come up with the bed. That brings them up to me. Now I'm not having to drop myself down so much. And we've got them in a position where they can support their feet and feel stable, which gives them a stable feeling of core rather than the legs dangling over the edge. From here then we're going to side flex. This is obviously side flexing away from me, so they're side flexing to the right. And when we do that, we don't really have very much that we can hold on to control and push them into side flexion. So what we need to unfortunately use is the thoracic cage, which is then in the thoracic spine. So you need to come quite low down, wrapping around the lower ribs, taking them over into side flexion from the lower ribs, and pushing, therefore, and watching for side flexion of the lumbar spine. Top tip as well, that if you feel that as you push them over, they kind of lean a long way, and you start to get this hip starts raising up, then a nice thing to do, if you have a towel handy or a pillow, is you can roll it so it's relatively, reasonably thick, and you can pop it under their right cheek. By doing that, it acts as more of a resistance. We'll have a look, see how he moves, and if we need to, we'll pop that in. Okay, so if you just pop, again, your arms just folded, but reasonably settle down onto your body there, so that we're not trying to influence, we don't want it too much up here. And then we're going to come down nice and low, try and keep my arm out of the way for the side flexion, so that I can raise my body up from this shoulder, pushing over into side flexion. So have a watch. Over into here. Now watch, see how this starts to rise? Yeah, so we're reasonably stiff on here. So if you just raise this up and down. See how it's already pushed him over into a slight side flexion? So now when I push, that's better. Yeah, so obviously I can grade this technique from here. Okay. If you find that handling is quite tough on you, that you feel like you're quite heavy, another way to do it is to wrap both arms round and into the side here. And what you can then do is pull towards you, and then your up and over force comes from this shoulder. Trouble with that being you've gone further up in the thoracic. This way. It's really non-specific now in terms of our side flexion. Okay, but this is just adding a little bit of resistance to the side. Side flexion, seated, but also supine lying.